The proposed ban on soda and candy for certain Americans receiving food stamps in Arkansas and Indiana, a plan spearheaded by state governors and health officials, is a controversial and troubling development that raises significant ethical, practical, and health-related concerns. While the ban may be pitched as an effort to improve public health, particularly targeting the issues of obesity and diet-related diseases, it oversimplifies complex societal problems and could lead to unintended consequences that exacerbate the very issues it seeks to address. First and foremost, such a ban risks further stigmatizing individuals already facing financial hardships. Low-income families who rely on the Supplemental Nutrition Assistance Program, SNAP, to make ends meet would find their already limited food options further restricted. This could be seen as an intrusion on personal choice, effectively reducing the autonomy of individuals who are already marginalized by their economic situation. The argument that taxpayers are subsidizing poor health by funding the purchase of soda and candy is not only condescending but also neglects the broader issue of structural poverty, which is much more complex than simply eliminating certain food items from a program. Such policies fail to address the root causes of health disparities, such as access to healthcare, affordable nutritious food, education, and socioeconomic opportunities. The proposed restrictions also introduce an uncomfortable level of paternalism. Health officials, including Robert F. Kennedy Jr. and Dr. Mehmet Oz, have advocated for this ban under the premise that it will improve health outcomes. However, the move risks overstepping, treating SNAP recipients as incapable of making their own food choices, while ignoring the fact that unhealthy eating habits are often driven by factors such as affordability, accessibility, and marketing, rather than simple consumer choice. Furthermore, targeting soda and candy alone doesn't even scratch the surface of the broader health issues that many individuals face, such as the availability of fresh produce or healthy meals in low-income neighborhoods. Moreover, the potential for this ban to backfire is high. While proponents argue that it will steer people toward healthier options, research suggests that simply restricting certain foods does not guarantee better eating habits. The USDA's previous refusal to approve similar bans highlights the challenges of defining which foods are unhealthy and implementing such restrictions without creating undue burdens on state resources. Furthermore, studies show that SNAP participants are no more likely than other low-income Americans to purchase sugary drinks or snacks. This suggests that targeting specific foods within the program may not be as effective as proponents hope. Instead, such measures could lead to resentment and resistance among SNAP recipients, who may view the ban as an insult to their ability to make personal decisions. The critics of this initiative, including anti-hunger advocates, have raised concerns about its fairness and efficacy. Gina Platanino from the Food Research and Action Center rightly points out that there is a lack of concrete evidence linking the consumption of junk food to the health outcomes of SNAP recipients. The move to limit food choices without substantial data to support the idea that it will lead to improved health could be seen as a misguided attempt to penalize the poor rather than empower them. The decision to limit food options also overlooks the need for comprehensive nutrition education and access to healthier alternatives, which are vital components of any long-term solution to improving public health. Additionally, the logic behind removing sodas and candy from SNAP eligibility is flawed. While these foods are often considered unhealthy, many people view them as occasional indulgences rather than regular meals. By targeting these specific items, the policy fails to address other unhealthy behaviors, such as the consumption of fast food, processed meals, or sugary snacks that are not on the ban list. This narrow focus could give the false impression that simply removing a few items from the program will have a significant impact on overall health. Another troubling aspect of this proposal is its potential economic impact. Trade groups representing the beverage and candy industries have strongly criticized the move, arguing that it unfairly targets low-income families who may already struggle with limited food choices. Chris Gindelsperger of the National Confectioners Association described the approach as misguided, and the broader criticism points to the risk of exacerbating food insecurity by removing beloved and accessible food options from those who are most in need. Critics argue that policymakers should focus on strategies that lift people out of poverty and provide them with better economic opportunities, rather than limiting their food choices in a way that doesn't address the underlying issues of inequality. Moreover, The logistical challenges of implementing such a ban should not be underestimated. The USDA has already expressed concerns that similar waivers in the past have been difficult to enforce, costly to implement, and unlikely to produce the desired health benefits. Policymakers would need to define and monitor what qualifies as unhealthy, which could be an expensive and bureaucratically cumbersome process. Additionally, such restrictions could lead to confusion and further strain on an already overloaded SNAP system, which is intended to provide support to millions of Americans struggling to feed their families. In sum, the proposed ban on soda and candy for SNAP recipients in Arkansas and Indiana reflects a troubling trend of punitive, top-down health policies that fail to address the root causes of poverty and poor health. While the intention may be to improve nutrition, the plan risks deepening stigma, infringing on personal freedoms, and potentially exacerbating food insecurity. Without a more nuanced and comprehensive approach that includes better access to healthy foods, education, and support for economic mobility, such policies are unlikely to produce the positive outcomes they promise. Instead, they may inadvertently harm those they seek to help, further entrenching social and economic inequalities in the process.